Hi, I'm Conor Phelan, owner of Phelans Pharmacy. Thank you for choosing Phelans Pharmacy for your flu vaccination. The flu can be a very serious illness. By vaccinating yourself against it, you reduce your chances of contracting the flu by about a half. If you do get the flu, you're likely to get a far less serious episode of the flu. You're also protecting your family, your friends and your community in general by being vaccinated. The vaccine takes about 2 weeks to work, so it is possible you can get the flu immediately after being vaccinated, but the vaccine cannot cause the flu. So I've already spoken to you about the flu vaccination in general, and now I want to address the issue of flu vaccination for children. This is available free of charge for children aged between 2 and 12. It's given by way of a squirt into each nostril. There's no needle involved, it doesn't hurt, it doesn't take very long. So it's very easy to do. And children who are in a clinically at-risk group receive a second dose. If they're in the ages of 2 to 9, they get a second dose 4 weeks later. The vaccine itself, the intranasal vaccine, it's a live vaccine, but it has been weakened so that it doesn't reproduce within the body at body temperature, so it doesn't cause an infection. Well, first of all, if you're allergic to any of the excipients in the vaccine, and one of these will be gelatin, another will be gentamicin, then you should discuss this with your pharmacist. If you're severely allergic to eggs, please discuss with your pharmacist also. If you have a deficient immune system, maybe because of a particular disease you have or because of particular medication you're taking, this needs to also be discussed with your pharmacist. If you're taking aspirin, which is unusual for children to be taking, but if you are taking aspirin, you shouldn't have the vaccine. If you're a severe asthmatic or if you're currently wheezing, you need to discuss this also. Other people that shouldn't get the vaccine will be those that have close contact with somebody who's severely immunocompromised. This, for example, could be somebody who's having a bone marrow transplant and has to isolate. If you're taking antiviral, anti-flu or antiviral medications, please let your pharmacist know because this would be a contraindication. So like the injectable vaccine, the intranasal vaccine can also have some side effects, and some of the more common side effects that people get include a runny nose, a fever, a headache, a feeling of unwellness, weakness and muscle aches. These side effects don't last very long and they're much less than you would get if you actually got the flu itself. Very rarely there are more serious side effects that can occur that I want you to be fully informed about. One is a syndrome called Guillain-Barré syndrome. This is a neurological type syndrome, but it's very rare, 1 in 500,000 people. If you did get it, it will be life-changing, but you can get it from the flu also. The other one is an allergic type reaction called anaphylaxis. This again only occurs in about 1 in 500,000 people. Your pharmacist is trained to deal with it. The symptoms of it would be skin rashes, clammy skin, swelling of the face, lips and eyes, and difficulty in breathing. It usually occurs within the first 15 minutes after vaccination, and that's why we ask you to stay in the pharmacy for 15 minutes after being vaccinated. It can, however, occur after you leave the pharmacy. If this does happen, you should call an ambulance. But again, I want to emphasize, these are extremely rare events. If you're concerned about any of the side effects you're experiencing, please feel free to come back to the pharmacy at any time. Thank you for choosing Phelans Pharmacy. I hope you have a happy and healthy winter.